Dr. Heller, you spent decades developing Palmar cooling technology and have determined what works best in transferring heat from the body. You've also learned many features that limit effectiveness. Can you please talk to us about the issues when the hand contacts a metallic surface?
Sure. What you have to realize is that the blood flow to the palm of the hand is under reflex control. It's certainly under central control. When your whole body heats up, that sends messages to increase the blood flow to the palm. But if you cool the palm itself, you can get even unilateral vasoconstriction or tightening of the blood vessels that prevent the flow. Now, there's usually the feeling of most people that metal should be the heat exchange surface because metal has a very high thermal conductivity. Okay? But also that increased thermal conductivity means that the cold sensation when you touch a metal object is greater than the cold sensation if you touch a wooden or cloth or plastic surface. So some of the devices that are available now have metal surfaces for the heat exchange contact. And when you touch that surface, it feels colder than if you touch the desktop or the tabletop next to it. So even though we know that we have that vasoconstrictive threshold, that vasoconstrictive threshold will be at a higher temperature if the heat exchange surface is metal rather than some other material.
And if I'm correct, Dr. Heller, at one point years ago, you had tried out a device that did have a metallic interface, and you ultimately decided that was not the best way to go. Is that correct?
Correct.
Thank you very much, Dr. Heller.